Hello, good evening.
Good
evening, sir. Good evening, sir.
Good evening, sir.
Good evening, sir. We are very fine.
We thank God. I would like to find out if you have. Okay, once again, welcome to today's lecture. Please, today for our lecture, in case we hear noise and my background, forgive me, I'm somewhere in Central Region, so I'm not home. I'm in Central Region. So in case where I am, in case you hear some background noise, don't worry. I hope can forgive me. But before I proceed to today's lecture, I would want to find out if you have any what do you call it, question, contribution with regards to what we did last week. Any question or contribution on what we did last week? No, please. Okay, so without any question, we go straight to today's lecture. We are looking at logistics management information systems. And when you talk of logistics management information system, what is it about? Have you heard it before? We have health management information system and logistics management information system. Have you heard about any of them before? Hello? Hello? Okay, come to 4.
Yes, we heard about health management information system in nursing informatics, and with that, in our practice, we usually it's more like a software or a program that we use to collect information from our patients and to manage them.
Okay,
how
that one is for
information
patients' data.
for exactly.
You use that
So
one
I
to collect
believe
patients' data.
exactly. So I believe
Okay.
with logistic management information system, it will have to do with how information with regards to logistics and how it flows from department to department and the other processes involved. Thank you.
Thank you very much. You're welcome. Okay, any other? Okay, so when you talk of logistics management information systems, logistics management information system is a system of records and reports that you use to collect, organize, and present logistics data gathered across all levels of the system. So here, the logistics management information system, it is used to record the report that you use to collect, organize, and present logistics data. So whereas the MIS, okay, we get to the HMIS, that one deals with patient records. This one deals with commodities, deals with transactions and other things. A logistics management information system collects, organizes, and reports data that enables people to make logistics systems decisions. So the logistics manual is a system which is used to collect, one, organize. How do you organize? It means that you analyze. Okay, you collect raw data and then analyze the data. Okay, then you put it in a report form. You put it in a report form, in a data that enables people to make logistics decisions. So once you collect, because the raw data cannot be used unless it is organized or analyzed. So you collect the data, you analyze it, and then you are able to use it to make decisions. Collecting data for managing logistics system is separate activity from collecting data about patient and health services, which is what health management information system collects. So the difference is that the LMIS deals with commodities, whereas the HMIS deals with patients and health services. So let us look at the difference between the LMIS and then the HMIS. We're dealing first with the HMIS. On the HMIS, data is about patient health, is about patient health conditions or health services rendered. So this one collects data about patients, health conditions or health services. So here, the number, the patient, the number, you pick the HMIS big data from patients, okay, individual patients, their health conditions, and then the services rendered. So what are some of the services rendered? We can talk about lab, we can talk about lab services, laboratory services, we can talk about X-ray and all the other services that are provided. So here you pick the individual condition, if it is malaria, and then the services rendered, the drugs given, or the diagnosis conducted, and then all these things are recorded in the LMI. The second difference is that data is collected and recorded daily, and usually compiled and reported monthly or quarterly. So here, every day, you collect with the HMIS, you collect patient data on daily basis, and then you compile them and report them on annual, either on monthly basis or quarterly. So in your case, you do your reports on quarterly basis or monthly basis?
It's monthly basis.
You do yours on monthly basis. Okay.
Yes,
so the third point is that data collected may be analyzed monthly or quarterly. To determine disease patterns, data may be used annually or every few years to track disease patterns or health service usage. So this one, you use it to, with the data collected, okay, you analyze them to determine disease patterns. So that if more people, that's why they are able to determine that this disease is the prevalent. We have this disease like when you go to the north, okay, around this time, they have this, what they call the CSP. What is the disease? Cerebrospinal meningitis. These are the diseases happening because of the weather. And then you don't just get up and say that people are contracting disease. It's through analysis, it's through the data you collect that you can say that, okay, there's the pattern, okay, of this disease is prevalent, so we need to prevent it. And for you to say that these are the diseases, these are disease pattern, you need to do some analysis, and the analysis are done using data collected and then reported into the HMIS. Let us look at the LMIS, which is our main topic for the day. We are looking at the Logistics Management Information System. The Logistics Management Information System collects data about commodities. Okay, that is the quantities issued, dispense, used, received, lost, stolen, damaged, or ordered. So if I should break them down, the data, the LMIS, you collect data on quantities issued. So anytime you send items, or commodities to the ward or any other department, you record it. Okay, that's the issued. And then dispensed. There's difference between issues. So this one, the issue ones, you issue to the various department. And then when you talk about the drug dispense, that's the pharmacy shop or this dispensary. The drugs that they issue or patients. And then used. When you talk of the used, okay, this one, when you talk of the dispense, we are talking about the items given to patient. And when you talk about the items used, you know, some of the items are not given to patient. Okay, they are used in a department. Some are used in various departments. Okay, and then we're talking about items that you have received. Commodities you received are items that have been sent into the various facilities received by the stores. So when you talk of the quantities issued, we are looking at the ones that are issued from the stores. Okay, the dispense, we talk about the ones that have been, items that have been drugs. Normally we are talking about drugs and other things dispensed to the patient. And then we talk about used. When the used can be referred to drugs and non-drugs, what we call it, items. Okay, then we talk about the received. The received are the items that have been sent to the warehouse, to the facility, and received by the stores. Here, you also record lost, stolen items as well as damaged items. At times, some items get lost in the facility. And mostly, some health professionals abuse drugs. There are drugs that are, and all of you do it. You go to hospital, you go to work, you have headache, and then you go and take paracetamol. You don't record that you have taken it. So all these ones are recorded as lost or stolen, not with the intention of stealing, but when you are sick and when you are in the hospital and you feel that you have headache and you go to the pharmacy, they don't sell the drugs to you. So how do they account for it? So it is captured under lost or stolen. And then there are some of the items also get damaged. Okay, sometimes when they are not properly handled, they get damaged. And those ones too, you record them as damaged items. And then ordered items are items that you have requested, the orders that you have made, the items that you have requested to be sent to you. So data, those are the ones. So those are the when we talk of commodities, data about commodity. These are the item, the data that you input into the system. The next one is data is collected and recorded daily, usually compiled and reported on monthly or quarterly. Like the HMIs are used and all those undamaged ones, you also record them. Data are analyzed daily to assess stock status. Data are analyzed and used monthly or quarterly, like you people it gives you information about inventory, data, inventory status, and then data use. This one also helps you. Which second point is ambiguous? Can you explain?
So the one
what
that
makes the second statement ambiguous? Which of the statements?
So the one that you said data is collected and recorded daily. So I'm a little bit confused because you said it is collected and recorded daily. There is no anything, whether it's for the health, whether it is for the stocks. That is why I'm saying it is ambiguous to me.
So here I said that LMIS deals with stock, whereas the HMIS deals with patient records. So here we are talking about stock. I get what I'm saying. Hello.
Yes. No, I have
one we are
gotten
dealing
it,
with
sir.
stock.
Thank you.
The HMIS deals with patient records. This is about stock. So data is collected and recorded daily. So we are talking about stock data on stock. Are you okay now?
Thank you very much. I'm okay now.
Okay. So you analyze, the third point is that like the HMIS data, what is analyzed to determine disease pattern. This one you analyze to assess stock status. You want to know the level of stock you have. It also helps you to know the consumption pattern, which items are mostly needed, okay, or which items are frequently demanded. You need to know all those ones when you use the LMIS data to do that analysis. Then let us look at the essential data for decision making. Essential data for decision making. If data are to be collected for decision making, you need to know what data to collect and how frequently to collect it. If data are to be collected for decision making, you need to know what data to collect and how frequently to collect it. To decide what data to collect, look at the decision you will need to make. So here, when it comes to the essential data for decision making, when you are making decision, you need to know which data, which type of data do you need to be able to make decision on what they call logistics decision. So you need to know which data you need to collect based on the decision that you are making. So think about the questions logistics managers might ask. What information will they need to answer those questions and make informed decision? So when collecting data, you need to look at the data that are important. You know that are we even able to determine this kind of data is difficult and nobody will ask for it as to whether drugs issued to consumers are actually used or not. But with certain commodities in the telcos, it is easy to know whether SIM cards sold. Please, is my background noisy?
It's okay, sir.
It's okay. It's okay, sir. We can hear you.
No,
You can, okay. Okay. So what I'm saying is that when it comes to decision making, the kind of data you collect is very important. But certain data is not verified. You can't get them. For instance, if you want to determine whether drugs that are dispensed to patients are taken or are taken timely, it is very difficult for you to do unless you start doing survey. You start interviewing people, and that one is very, very difficult for you to get accurate information unless the ailment, okay, the patients are what they call it, the disease or the sickness does not go and the person comes back. Okay, if it doesn't go and the person is supposed to come back, that is when you'll be able to know that the person took the drug or not. So such data, they will not ask you to input into the LMIs because it's not possible for you to get that data. But then when it comes to items dispensed, items used, the frequency, you'll be able to provide it. And then this will help them to make decision. So let us look at the three essential logistics data items. One is stock on hand, quantities of usable stock available, quantities of usable stock available, stock on hand. Items that are unusable are not considered part of stock on hand. So when we talk of stock on hand, we are talking about quantities of usable stock available. So when we talk of stock on hand, you don't add damages, you don't add expired drugs, you don't add obsolete items. We are talking about usable items. And then we're talking about the next is consumption. The quantity of stock dispensed to users or used during a particular time period. So these are the data: consumption, stock on hand, and then losses and adjustments. When you talk of losses, losses are the quantity of stock removed from the pipeline for any reason other than consumption by a client or used at a service delivery point due to expiration, theft, damage. So for losses, it could be any item which has been removed, or any stock removed from the warehouse or pipeline for any reason other than consumption. It means that the item wasn't consumed, but then it is stolen, or it is expired or damaged. We consider them as losses. And then when you talk of adjustments, you realize that anytime you transfer items from your end to another maybe facility, maybe from, assuming you are at Confanochi and you transfer items from Confanochi to Menchia Hospital, you are asked to pass adjustment because these items, you haven't issued them, you haven't sold them, it is not damaged, it is not stolen. You've transferred to another facility by others. You were ordered to transfer them. So there will be a column in the LMIS that they've indicated adjustments. So the adjustments will indicate that this quantity was transferred to maybe Menchia Hospital, under maybe authorized by so and so. Then you put it there, so that anytime, and before they do that, there was also, they will send you a message. So when when auditors come, you will have information that you didn't transfer or you haven't done adjustment on your own. That adjustment was based on directives. And so that is it. So these are the three essential logistics data items. It means that when you go into the LMIS, you need to know stock on hand, the physical stock, consumption that is used, okay, items used, and then we have the losses and then adjustments also there. So these losses and adjustment could be what? The losses could be due to expiration, theft, or damage. So the adjustments are there. Is it Colin? Colin, you raise your hand.
Yes, sir.
Yeah.
My question is LMIS. When you, because of the three things that you have mentioned that we are looking at, so if items you have gone to buy items to come and add it to the already stock, will that item will also be included in LMIS model?
Stock on hand. It becomes stock on hand. Are you getting it?
It will come and be added. Okay.
It will be added to the existing stock, so it becomes stock on hand.
Okay, thank you, sir.
Okay. So for adjustments, I've explained it. So let us go to the three types of logistics records. Okay, we talk about the three essential logistics data. So here we have the stock keeping records, holds information about products in storage. John India.
Yes, sir. Please, with the adjustment, you've used some scenarios to explain. It's either your facility is giving out other items to another facility, or another facility is giving out to your facility.
Yes.
So in that instance, as to when do we consider that kind of adjustment to be positive or negative adjustment?
No, when you are receiving, it is added to stock on hand, because when we go to the bin card and then those things, you see that you have items received, items issued, stolen, adjustment. If we are passing adjustment, it means that you are transferring item to different location under instruction, because you don't do the adjustment on your own. You sit there and somebody calls you, oh, we need items, can you send it? You need to ask permission before you do that, because you don't have the right to do. Or is that how you do it? Because somebody must tell you to issue. Are you getting it? And once you issue that item, once it is accepted, officially accepted or directed from the above, when you send them, you pass adjustment, because your stock will reduce. I get what I'm saying.
Okay, so at that instant, it becomes negative.
Reduce. So if you don't put the quantity in the adjustment column, anytime auditors come, you wouldn't be able to answer. Sometimes some of these things, you often hear that people have stolen items, or they've squandered money, items sent to them have been, they've not been able to account for it. You hear it all the time. It is not always the case that they've embezzled it or they've stolen the item. Sometimes some of these things occur. The issue, they don't pass adjustments. With time, sometimes you forget about them, especially when you are dealing with emergency cases. Are you getting it? Emergency cases, sometimes you don't want to go through all the processes because it will delay. It will delay your healthcare, whatever. And so you try to say, oh, let me finish. When I come, I'll record it. People finish and then they don't record. They don't record it, and then it becomes an issue. Are you okay with regards to the adjustment?
Yes, sir, I'm okay, sir.
Yes, sir.
So we talk about 3 types of logistics records. So 1 is stock keeping records. 2, so when we talk of stock keeping records, it holds information about product in storage. So with the stock keeping records, all the items you have in stock, you have information about them. The item, the quantities, expiration dates, and sometimes the monetary value are attached to it. Then you have the transaction records, holds information about product being moved. So with the transaction records, every item you move, either to the department or to the ward, you need to record it. And then consumption record. This is about items that have been issued and consumed, or items being consumed or used. You need to have records on that. So you see, there is difference between items. Transaction record is different between consumption records. Because if I move item from the stores to the ward, it doesn't mean that it's been consumed. You may still have the items there. Are you getting me? Hello?
Yeah. No, sir, please.
Yes.
What I'm saying is that when I issue item to the ward, it is not consumed immediately. Anytime you pick item from the stores, do you consume all of them at a go? So when you are putting the information in the, what do you call it, in the LMIS, you have items that you have received. So they are still part of when the stores, when they are collecting data, they will say that these items are still in stock, or these are items on hand. But those that you have issued to patients, or those that have been consumed, in the course of your duty are considered as what? Products used or being consumed. For instance, if you issued, let's say, infusion, you issued infusion to patient that you have about, let's say, you're supposed to have about 4 or 5, okay, drip for one patient. Those items are being consumed. So it can be recorded as what? Consumption. Because those items have been earmarked for consumption. And so it can be considered as what? Consumption. It can be added to the consumption records. But items that have been issued to the world and are still not used cannot be captured under the consumption records.
So, Doc,
Are you getting me? Hello?
Yes, sir.
Are you okay?
So
Hello,
yes,
sir.
Okay, so somebody has indicated that yes, we can say that the receiver, the one receiving it, will make a positive adjustment, but then that person can't make any adjustment. If you are receiving it, you have received it, and it goes into your stock on hand. It is only the giver who can pass adjustment, and normally the adjustments are always negative. Are you getting it? The one receive it. You receive it and then you add it to your stock on hand. But the one giving out for record purposes, you indicate, you send it to adjustment. It's been transferred to another department.
Then,
hello.
Then,
please. With the adjustments, let's say if there has been an order from my facility to another facility that that should maybe issue some consumables to me, then I receive those consumables from that facility. Will that become part of the adjustment?
That one will be added to item received. I get what I'm saying.
Yes, sir.
It will be added to your stock receipt because over there, for instance, if it was the, what do you call it, the regional, what do you call it, or the central store that ordered them, that requested for the transfer, they would debit your account over there and credit their account. They will credit the account of the giver. Are you getting it? Whilst
yes,
debiting your account, so that one becomes part of your stock, your total stock. But the giver will pass that adjustment that I have sent this quantity to these people.
Okay. Thank you very much.
I get what I'm saying.
Yes, please, sir.
You are receiving it, so it's like okay. So what is it, Lilibet? Is it, what is the name? Is your name still can't mention it. So if you raise your hand, you can talk.
Doc, my question now lies on the positive and the negative. Because
please, your line is faint. Your voice is faint. Can you speak louder? I can't hear you.
My question lies on positive and negative adjustment area. The positive and the negative adjustment area. For instance, I am the one who
said adjustments.
That is what
you see, we said adjustment. We didn't.
Hello. Getting the last sentence. The last sentence at the adjustment place, there is positive and or negative changes to the stock. So I now want to find out at what point will there be a positive
adjustment may involve either positive or negative changes to stock. So when we talk of positive or negative, listen, the negative is that you have reduced your stock. Are you getting it?
Yes.
And definitely your stock, the quantity at hand will reduce. The one who is receiving it will have his quantity increase. I get what I'm saying. But then the one receiving it will not go and make any adjustment because you have received you haven't transferred any. You haven't given any stock to anybody. So when it comes, it goes into your receipt. Because we have the receipt. When you look at the bin card, you have receipt, you have issue. I getting it. So once you have receive it, it is recorded at the receipt side and then added to your total stock. But the one who is donating will just pass that adjustment, and it could be negative too because it has reduced that person's stock. I getting it?
Yes.
It has reduced that person's stock. Or the adjustment could also be negative. We can talk about damages, okay? We can talk about damages. This one goes into losses, okay? The damages and expiry and all those ones goes into losses. So with when it is negative, definitely it will affect the one donating the item. So adjustment is always negative. Let's study bin card. Let's look at bin card. We are looking at bin card and then inventory control and then ledger. These ones, I know you have some idea since you are all practicing nurses. Since you are all practicing nurses, I would like to know what do you call it? When we talk of bin card, what is bin card? If we've been using it, what is bin card? I don't want the reader, I want an explanation. Enyable.
Okay, so with the bin card, it holds the record or
with a bin card.
Yes.
Okay.
Yeah, it holds the record or information of about the products that you have, including the amount that you have received or issued out, the expiring dates, the item or the item's badge number. So it goes hand in hand with the ledger. Thank you.
Okay. Okay. So thank you, Mustafa Abdullahi. Mustafa Abdullahi, your hand is up.
Hello, sir.
Yes, Mustafa.
Please, can you hear me?
Yes, I can.
Yeah, please, bin card, it contains information of like the data of the items, like from whom receive, and when you look at it, it also contains quantity issues, quantity receive, and like you mentioned, losses and adjustments, and then quantity at hand. So when you take a bin card, it contains all these informations. Thank you.
Okay. Welcome. Conan.
Yeah, yes, I would say bin card is a form of card that are used by dispensers or store officers in a health setting. That is usually when you are coming to receive a supply from outside, you enter, and if you want to also issue supplies to department, you enter those entries in the bin card so that when somebody come to look at the distance to monitor the way you supply items and receive items are, then you will see that it is balanced in the facility. So either dispensary or stores officers are those that are using the bin card.
Okay.
Thank you.
Okay, thank you very much. Thank you. Joseph.
As my friend my colleague has already said, it's also a tool that is used to monitor your stock levels. So that at the stores or wherever you are using it, that is what you need to monitor whether the amount of things that you brought, whether they are being reduced or are there enough quantities so that
which one?
Request
But
for
do you know
more?
the name?
The name,
Hello,
Is
sir.
that the number?
Hello.
Okay. Hello.
Yeah, so it's like a daily tally cast that we use to tally the things that we have at the stores or the dispensary or wherever we are taking the store, so that we can monitor how our things are going by issuing them to the other departments. We monitor so that we know that at this time the stocks are going low, or we are short of this and we are short of this. They contain the information for the expiring dates of the drugs that are the items that are around, whether drugs or whatever items, and where there are batch numbers and where they were issued from and where they will be issued to. So I think that, that's what I understand. I've seen it being used for. Thank you.
Welcome. Okay. Thank you very much. Let's continue. Okay, so when you talk of the bean card, it seems all of you have idea. You have idea about bean card, what bean card is, and the function. So bean card is an individual stock keeping record that holds information about a single product by lot number or batch number. So with a bean card, it holds information about single product by lot number or batch number. So assuming we pick paracetamol, we may have different, what do you call it? Do we call it dosages? So if you pick paracetamol, these days previously we used to have 250 milligram and then 500 milligram. But it appears recently all of them are 500 milligram, the tablets. And then we have the syrup. So when you pick a bean card, we use the batch number or lot number. The batch number helps us to determine, to find or to determine a particular batch. In case we detect any anomaly with the product, we use the batch number to withdraw those products. So when you see a product with one batch number, it means that, that when it comes to production, we have different way. We have the batch production, we have mass job shop, and then we have mass production. Even with mass production, you still need a batch number. So if you buy, let's say, a box of mineral water, okay, let's say Voltic, one box of Voltic. If you pick each bottle, all the bottles, in case they are 24 in a box, all of them will have one batch number because they were produced at the same time. So that if we are tracking that batch, you use the number to track all that, the product that were produced at the same time. Then, so you pick, let's say, paracetamol, and then we have the inventory control card. With the inventory control card, the difference between inventory control card and then the bean card is this. The inventory control card is individual stock keeping record that holds information about all the lots of a single product. The inventory control card may be summary of many bean cards for a particular product. So you pick one bean card, and then maybe paracetamol. You know, paracetamol, we have different brands. You can have the one coming from Letap, the one coming from M&G, maybe from Kena Pharma, different brands. And when you pick a bean card, you can put different brands on, then different brands, even the same brand, you can put different batch numbers on one bean card. And when it comes to the inventory control card, you can have the same lots. Okay, let's say paracetamol coming from Letap, with paracetamol coming from Letap with different, what do you call it, batch numbers. So you can have 10 batch numbers on one inventory control card. Okay, well, there are reports on it. Because this one is inventory, you use it to control inventory. You use it to check your stock level. Then we have the store's ledger. And when you talk of the store's ledger, it is like a big book. Normally, the accounts people use it. And I know the hospital, I know the nurses, you also use it. That big book that you record. Sometimes a patient, you write the patient name, the ailment, the treatment, the items given. You state all of them for records purposes. And so the ledger is a stock keeping record that contains the same information as inventory control card described above. Unlike inventory control card, a store ledger is bound like a book and is used instead of the individual card format. So instead of people using bin card or inventory card as individual card format, you go for the ledger. It's a book, so you don't remove them. You have all the information in one big book. That's the difference. But it's the same format. Okay, they use the same information that are recorded in the ledger. So this is an example of a bin card, okay, on the screen. You see a bin card. So assuming there's a bin card for a product. So you have the commodity lot or batch number. Every product has a batch number. So you write the batch number there. You have the product name or description. So you can say that paracetamol syrup. So paracetamol is the product name. The description is the syrup or tablet. You put there. You know, there are some products that we have the tablet. There are some products that we have capsules. So you indicate if it's capsules. You indicate if it is suspension. Okay, you put it there. If it is suppository, you put it there. So that is how it is. So the description will either be suppository, suspension, tablets, capsules, syrup. You indicate it. Or it could be an ointment. Okay, you also indicate that one there. Then when it comes to the date, you have the date. So if, assuming today we've received an item. So you put today's date there, 31st January, then you have the transaction reference, which you will pick from the system, and then received or issued. So we are receiving. So the column, you put item received, you put the quantity there. Then quantity, you put, so received, you indicate received. Then you have the quantity. So here you have what? The quantity, this one, so issued. If you are receiving that, when it gets to the issue, you ignore. You put dice there. When it comes to losses, if we have no losses, you leave it. You put dice there. If you come to adjustment and there hasn't been any adjustment, that one too, you leave it. But the quantity on hand must be recorded because you have received the item. Assuming it is the first item you are receiving, and then you have 100 quantity, then you put the 100, the same 100 on quantity or in the column for quantity on hand. Then the initials, you, the recipient, you put your initials there. So when it comes to issue, because the first row we have, what do you call it? The first row we have receipt. When it comes to the second row, you have, so the same date, it could be issue. So you still have the reference number. So issue to, maybe this one was issued to Confanoche Hospital. Quantity issued or quantity. So when it comes to quantity received, we are not receiving, we are issuing. So you indicate dash. Then you write the quantity. If there are no losses, you leave it. If there are, you indicate the losses there, then adjustment, and quantity on hand, and then initial. So this is how you fill information on the bin card. Hello, so are you okay with the bin card?
Yes, sir.
Yes, sir. Yes, sir. We are okay with it.
Say,
No, sir.
please, the bin card, can it be used for more products, 2 or more products, or it's just one product?
Or with the bin card, we use just one product. It is the inventory card that you have multiple. But the bin card is for just one product. Are you okay? Any other question?
Sister Sewa.
We are begging you.
Please, what I'm saying is that with a bin card, we use the same bin card to issue and receive stock. Are you getting it? So when it, for let's say the first column or the first row, the first column here, you have the date. The row, okay, the first row here, you have the date. Assuming you are receiving an item or you are receiving items, you have the date and a transaction reference. Then if you are issuing, then issue to whom are you issuing this to? So if it is to the, let's say, the ward, then the person receiving its name should be put there. Maybe Audu, okay, / your department's name. Then the quantity that was issued to you is recorded. When it comes to losses, assuming we haven't, so we are not dealing with losses. We are talking about what do you call it? Issue. So adjustment and losses, we don't deal with it. Then after issuing the quantity to you, assuming quantity at hand, okay, was 50, and we've issued 10 to you. So the quantity on hand, the remaining 40 will be put there, and then the initials of the one who issued the items to you is also put there. Are you okay, Audu?
Yes, sir. Thank you, sir.
Oh, the bin cards are used in the wards as well as the stores. The bin cards are used in the wards as well. Probably you find yourself in an area where you have access to computer and other things, so you wouldn't bother yourself with these things. But some are still using it. Please, are some of you still using bin cards in your facilities?
Yes, please. Yes,
sir.
Yes,
Yes, sir.
Yes.
Yeah. So it's still being used. The bin cards are still being used because some facilities, they don't have this electronic thing. Some of the hospitals, now even some of the private hospitals, they no longer deal with paperwork. Everything is, when you go to the lab, they don't give you the lab. Okay. This one is different. The bin card is different from requisition book. The requisition book is used to request for items from the store. So please, that one is different. Do not let us confuse ourselves with the issue, what do you call it, requisition form. Albert.
Please, I want to find out about the receiving and the issuing. Most of the times, I do see they using red pen for the receiving and then the issuing, no blue pen. I don't know whether it's institutional discretion or
it's
academically accepted.
No, it helps you to distinguish. I getting it. So when you see red, you know that it is issue. When you see blue, you see that it is receipt. I getting it. Just to distinguish the two. But in some don't use it. Some use it just to distinguish. It is not compulsory. It depends on organization. If your organization demands that you use 2 pens, one for receiving, one for issuing, then you do that. Okay, so let's look at the control, inventory control, what do you call it, card. You have the same information on the bin card on the inventory control card, but the inventory card is used for multiple products in the same, what do you call it, let me get the actual word. In the same, what do you call it, lots, or in the same lots, or different batches. When you talk of batches, it should be different. So here, assuming we have paracetamol, so still you have one, you can't put multiple items there. You still need one item. So here we have paracetamol. We are dealing with paracetamol. You have paracetamol, let's say syrup. You may have paracetamol tablets. So you indicate them. This is for inventory purposes. And so the bin card may be in the ward, whereas the, what do you call it, the inventory control card will be with the stores. Two dates. You can't use one date, because if receipt and issue occur at the same time, you write the date. You can't say that you write the date across. Let them be different, because we are talking about different items, different, what do you call it, activities. So when you talk of transaction records, what is transaction record? Albert Saki.
Please, with the inventory card, I want to know if it's only the batch numbers that you can write one medication with different batch numbers, or let's say one. Can you write one?
If you use lots, okay. If you use lots numbers, you use it throughout. If you are using what do you call it? If we are using batch number, use it.
So my
Please, is my line breaking?
Hello, sir. Yes, it was breaking, but I think I got you. My question is, okay, can you use different companies? Let's say paracetamol from Leta, paracetamol from MNG, paracetamol from. Can you use that one too?
Yeah, if we're dealing with paracetamol and they all have different batch numbers, you can do that. You can put them on but on the bin card, it will be individual.
Okay, thank you very much.
So let us look at the transaction records. Transaction records are used to record information about the stock movement from one storage facility to another. In addition, transaction records are proof of requisition, issue, and delivery. So when you talk of transaction records, it's records of all the what do you call it? Activities like requisition, like the issue and then delivery. So with the transaction records, you need to have records of those who have requested for item, that is the requisition, and those that you have issued, the request that you have fulfilled, that is the issue, and then delivery, how those items were delivered. See, that sometimes a transaction record will be combined with a type of report and will include data like current stock on hand, depending on the system design, losses, and consumption data. So sometimes transaction record will be combined with a type of report. So that will include like current stock on hand and depending on the system design. So it depends on how the system is designed. With the transaction record, you're going to have stock on hand. That is the stock that you have, and then the losses and the consumption as well. And this one, the warehouse personnel at both issuing and receiving facilities complete transaction records. In pharmacies or storekeepers, pharmacy personnel or nurses may complete the transaction record. So this one, it depends. In some facilities, especially the chip compounds and other things, you may not have a storekeeper. So the in charge does the, the transaction records. While you have pharmacy, the pharmacy shops will also, the pharmacy personnel, the pharmacist will do it. But this task is for the warehouse personnel. Warehouse personnel from both issuing and receiving facilities. So if you are talking about the central medical stores or the regional medical store, they will issue to the district. So when it comes to transactional records, you expect that both the regional and then the district storekeepers will handle the transactional records. But where you have pharmacy, the pharmacist, and then nurses involved, they can also do, depending on the facility. So transaction records are started anytime a facility requests or issues supplies. So you start transaction records anytime you request, or you issue supplies. And they are filled in at any point in order, issue and receipt process when custody of the product is being moved, or when the custody of the product being moved changes. They are completed when the receiving facility confirms receipt of it. So there are at any point in time, transaction records are prepared. When you request, when you receive, you prepare, you report into the system. So you complete it when the facility confirms receipt of the item shipped. So once the district office receives information that they have completed a transaction, you go ahead to do. So let us look at organization of transaction records. So transaction records are organized by date and transaction number. How do we organize transaction records? We talk about date and transaction number, which helps identify the transaction. We have consumption records. Consumption records are used to record the quantity of each product used or dispensed to end users. So when we talk of consumption records, it's about the items that have been issued and consumed. So when the item is not consumed, you cannot recall them, you cannot capture them under the consumption records. You can capture them under transaction records, but if it is consumed, because you want to know, sometimes you issue items to facilities, they are not consumed. Okay, so assuming there are items that you send to facilities that are not used, and those ones you cannot capture them as consumed. You can capture them as issued. It can go under transaction, but it cannot go into the consumption records. So we say that consumption records are filled when suppliers are dispensed to clients or used by service provider during service provision. The total quantity of each product used or dispensed is totaled at the end of the reporting period. So when you record them only when the products are used by the client. If they haven't been used, you cannot capture them. So it's saying that usually data for consumption records are organized by the date of the visit, date of dispensing or usage. They record the quantity of specific product either dispensed to users or used by the end user. So here, you record the date that the consumer picked the item or the date that it was dispensed to the usage. And for the usage, you can only record it when you are witness to it, because sometimes you issue items to patients. Yes, at your end, you can capture it as consumed. But as to whether the patient consumes the item or not, you cannot tell. So for the usage, unless it is used in the ward, if it is used in the ward, that one, you can bear witness to that. So you can record it that it's been used. They record the quantity of a specific product either dispensed to users or used by the end user. How do we recognize? How do we organize consumption records? So this one, you can use it in a bound book like the ledger, or you can use paper. You can record them on paper and use it. So what you can also do is that you record the quantity of each product received by a customer. You do that when you are recording consumption. You write the client's name.
No, sir.
Do you write client's name? Hello?
No, sir. You don't write.
So what do you do? How do you capture it?
We do write the client's
Sir,
name.
we do write the name
of drug that have been used, especially maybe you are going to give tramadol, which is under key and log with the book. So when you pick it, you write the client's folder number. First you write the date you are picking the item, the client's folder number, the client's name, the insurance number, the quantity. If it is one, you write it one, and balance it with the quantity at hand.
Okay.
So that's how we normally do it.
David.
Okay, sir. Yeah. So I wanted to ask a question based on the information you are giving, the answer that my brothers are giving. You know, when you come to the big facility like the teaching hospitals, we don't deal with maybe in the individual right from the listening to the individual patient. We are with the consumable that we are talking about here. Is it only items that are used for patient, or because we have consumables and non-consumable?
Yeah, so you record every item that you use.
Right. So the example they are giving is only based on drugs. So when you see, we don't use this what do you call it?
We are dealing with health commodities.
Yeah, we are dealing with the health commodities. So I want to find out. Now, assuming
there are items. Let me tell you, there are some items that you don't pick them. You know that when it comes to the equipments, okay,
yes,
the equipments are given to you and they are recorded that this equipment have been sent to this facility. And at any point in time, they do audits to make sure that the equipments are there.
Yes.
I getting it. So they will, at the end of the supplier's end, on the storekeeper's end, they will capture it under consumption because these items aren't coming back. I get what I'm saying.
Good. So now
they are not coming back. So anytime they are recording, I get it. They have a way of recording it.
Okay.
You have a place, the non-consumables like equipments and other things. Okay. They have equipments that have been issued and then being used. Okay. So those items, they record them. And they have those that they haven't issued. Sometimes they may have some of the items in store, but they haven't issued. They also have a way of capturing it. But at the end of the day, when they are recording, okay, they can say that for this item, we have 50 of them. Okay, we have 50 of them. 20 are being used.
Okay.
30 are in store.
Okay.
That is how they are recorded for the non-consumables.
Okay, so that's what I wanted to get it clear.
Yeah,
right,
because if microscope, for instance, microscope, how do you capture it as consumed? Is it consumed? No, it is still there. But from their end, they will tell that they have issued these items. So that is how we talk of consumption, because these ones are not consumed. So we are the ones that we capture them under consumption are the consumables. Okay, Prince Osei.
Hello, sir.
Yes, Prince.
Yeah, in my facility, what we normally do is that we just focus on the commodity or the drug that has been issued from the main store. The ones that's at the dispensary, we don't normally focus on that. So I want to ask, are we doing the right thing or we are doing the wrong thing?
Who doesn't focus on that?
I said our storekeeper, when he want to do the recording, like he want to do whatever that we have consumed within the month. Those drugs in the dispensary, he doesn't focus on that aspect again. He only focus on what we have as stock in the store. So I want to ask if you're doing the right thing.
Have in stock. I don't understand this too. The one in dispensary.
Yeah. Yes.
No, the one in dispensary, he has the records. And then normally they deal with those that they have issued to the wards. When you are doing stock audit, okay, stock audit, we have the ones that have been issued to the wards. So they come, maybe you took 20 tablets of paracetamol. They want to know how many have been consumed and how many you have. They will still go to the stores and take that records as well. That is how it's supposed to be done. And you know how the reason why they don't bother, because they will first check from the stores. The stores will tell them these are the quantities that we have issued to the ward. And that's what they want to know, that the quantity that have been issued to you, if you've consumed it or they are still there. So they will pick and then add it to it. And that is, I don't know, but my former company, what we were using it to do, we're doing ad hoc audit. Sometimes we have the monthly one that everybody knows that at the end of the month, they are going to do stock count. But sometimes you'll be there and the auditor will come. I want to check the items that you have issued to the floor, whether they are still there. And they do. They do count. And normally when they come, that is where they are able to detect. You see, in audit, when you are working as an organization, this time when it comes to auditing, they are not waiting for the problem to come before they are now preventing it. They don't want it to occur. Because normally some people will squander in the facilities. Somebody may go for drugs or items, they will sell the items and then squander the money with the notion that, oh, at the end of the month, I will pay. For the person is expecting some money. But then by the time auditors come at the end of the month, the money is not available. And then when you check the quantum, you realize it is huge. Sometimes you search them, they cannot pay, also you dismiss them. That amount. So now what auditors are doing is that they want to prevent theft. They want to prevent it, even if it will occur, it should be minimal. It shouldn't be at the point where you allow people to squander resources, and then you are now be chasing where many of them they are unable to collect. There are few. If the amount is not too huge, they surcharge you, and then it is deducted from your salary on monthly basis. Some are too huge that even if you want to deduct it, by the time the person goes to retirement, you still be deducting even after death. So what do you do? So now the focus is to prevent it from happening. I getting it. Probably that is why they are always on you. So let's look at the quality monitoring of logistics management information system. So we need to monitor logistics management and for us to do it well. We start from data collection, digital records. Whether stock keeping, transaction, or consumption should be appropriately trained and have adequate time to carry out this responsibility. So for quality monitoring, everybody who deals with transaction or consumption records reporting, data should be reported regularly, and then logistics managers should review the report to verify the quality of the data. You don't allow that. The problem we have is that sometimes we have to do it quarterly or annual. By the time you go in, a lot might have happened, and then sometimes you find it difficult. So you make sure that you do it frequently. Data monitoring, aggregation, and not data. So you should be able to validate the data. You should be able to analyze, make sure that you have accurate and then consistently entered. Some will pick the data, they will not enter at the end of the month. We're saying no, data should be entered on regular basis. We're talking about real-time data, so that when I come in and I want information, the information should be current. The information should be current. Automated LMI using computer handheld devices, mobile phones, or the internet can help improve data quality. It can help reduce mathematical errors, highlight missing information. I like this clinic, SAS clinic in Kumasi Mall. When you go there, they don't use paper. Everything is paperless. Okay, apart from the paper they will give you for the vitals, it's the same paper they will give you for the lab. The lab results wouldn't come to you. It is inputted into the system, and then the doctor will just see it, and then do it. And so the next one so we have automated LMIs. What is saying that the LMI should be automated, okay, so that you avoid mistakes, you avoid errors. So some facilities have adopted this. As I mentioned, the SACS Hospital or SACS Clinic in the Kumasi Mall. When you go there, everything is lab results. You don't get a physical lab results. You go there, and then everything goes to the doctor. The doctor will look at it, tell you what the problem is, and then prescribe drugs. And everything goes to the pharmacy direct. And sometimes they just write in the same paper that they use. So unlike other places that you go here, a lot of paperwork, people are trying to avoid paperwork. So we're saying that for quality monitoring, the LMI should be automated. So let us look at the common challenges of logistics management information system. One is poor record keeping. We don't keep records well. Our records sometimes are incomplete. We don't update our stock and consumption records. We have poor reporting, late, incomplete, poor quality report. Sometimes, you see, there's a difference between poor record keeping. Okay. Record keeping is you writing whatever transactions with regards to logistics and then sending a report. That is you analyzing and then getting accurate report. Another challenge is that you see data not moving up or down the system. Facilities not submitting to district not submitting report to central not providing feedback to district. So you realize that lack of information dissemination, because you don't get information. You sit anytime you want to make order, you should be able to know whether those. Then the last one is data not used for decision making. We're saying that the LMI's data we collect in a part of the world, that one of the challenges is that we don't use it to make decisions. We just collect them for collect. So any question with regards to what we've done? Any question? Hello.
The inventory.
Anyangle, raise your hand.
Yeah, hello, sir.
Yes.
Mine is not a question, but just to add to what you said about the when a colleague asks of the reason why the storekeeper take the consumption from the ledger or from the ledger and not from the dispensary. I quite remember sometime or when they freshly introduced the distribution, the drug distribution per facilities. It came to a time you were being told to do our calculation based on the consumption, our last 6 months consumption. So mostly you look at it, you take that information from the ledger. So
yeah, so you look at your past record to forecast.
Exactly, from your ledger, because you will not get that one from the dispensary. It's the ledger that will help you, or your inventory or the BIM card that will tell you what is going on, your consumption from the past 6 months. So that's why it's happened like the storekeeper is taking that record from the ledger. So I just want to clarify or help clarify that to my colleague. Thank you.
Okay, thank you very much. Who else? Who else has a question?
Sir, I have a question. I want to find out if
okay, Lily. Please raise your voice. I can't hear you.
Like
Can you raise your voice? Can you hear him?
No.
Sir,
we can't hear you.
Doc, I'm saying. Oh, Doc, I'm saying that. Let's assume and get paracetamol. And let
the line is breaking. I'm not hearing you. Please, can anybody hear him? Are you hearing him?
No, doctor.
We can't hear him.
If you can type. Any question?
There is a question in the chat.
Okay, the chat. Okay, can we say inadequate training for healthcare workers on the system is also yeah, that's what we're talking about. Inadequate, poor record keeping as a result of inadequate training. What numbers are the same as a batch?
Sir, please, Lily-based question is there.
Missing item by found. Where will it be recorded? And so now you go back to the adjustment and you add it. You see, in the adjustment column, you need to pass comments. Why that adjustment? Are you getting it? So the adjustment, you don't just put the figure there. You indicate where the figure is coming from. So if it is a lost item and then it is found, it is still yes, you record it. You have what we call it stock on hand. But once you have stock on hand, it could be so you put it at the adjusted column and say that found item. You should give it a what do you call it? Description. You should describe the item. Oh, what is positive? Yes, you can, if you want to call it positive adjustment, fine. So you are adding, because if it is lost and you found it, yes, you need to, you add it to your stock. And then when adding, it will definitely go to the, what do you call it? You add it to it. So you can just, we can make it like positive adjustment. Probably we need to, I'll read about it. I'll search for it, how you capture that one as well. The inventory card. What I said with the inventory card is that with the inventory card record item. Okay, different, what do you call the same item with different batch number. So we talk of paracetamol. Paracetamol, you see, we have, let's say, Letab. Consignment you receive today, the batch number will be different from consignment you receive tomorrow. Are you getting it? So you put the consignment today when it comes to the inventory control card. Where you have the item received, you may have the same paracetamol coming from Letab with different, what do you call it, reference number. So you input the reference number there to separate it from the others. Are you okay?
So is there a clear difference between inventory control card and bin card? Because if you say bin card is just for a single item. And
bin card is for single item.
Yes.
Bin card, if it is paracetamol, you see, that is why we use the batch, and the paracetamol, we may have different batches. But you don't add, you see, the bin card, this is how we use one batch. That's how we talk about the lot or the batch number. The batch number is important. It helps us to track the item in case of anything. So that's why I'm saying that on the inventory card, that is why here we have the product code. The product code is different from the batch number. So when you go to the stores, every product has a code. especially when you are in a warehouse, a very big warehouse like the central stores. When you talk of paracetamol, they have different brands. So they've given them codes. And they use the code to track. So when you talk of paracetamol, they will have one code for paracetamol. Then under that paracetamol, let's say the one coming from Letap, you may have different batch numbers. Are you getting it? But then this inventory control card will be for all the paracetamol coming from Letap. If it is capsule, if it is suspension, what do you call it, syrup, you have the syrup. If it is tablet, you have paracetamol tablet, because paracetamol tablet code will be different from paracetamol syrup code. So all the syrup coming from Letap will be on the inventory control card with different batch numbers. So you know that this item, this batch number, though they are all Letap products, they were produced on different dates. It is the date that brings about the batch number or a batch. So let me say particular batch, let's say around this period. Around today, if you are producing paracetamol, today we'll get different one batch. Tomorrow's paracetamol that we produce will get different batch. That is how it is. So that when we receive them, when they bring them, we pick today's batch, today's transaction will be on the inventory card. Tomorrow's production will be there. They are all paracetamol. They have one code because they come from the same brand. It's the same brand. They have the same code, but different batch numbers. I get what I'm saying. Okay, so without any question or this contribution, we'll bring our lecture to an end. Thank you for coming. Have a wonderful weekend. We meet next week, God willing.
Thank you, sir.
Thank you,
Doctor.
Looking forward to meeting you.
Okay, I wish you all the best.
Thank you, sir. Thank you.
Welcome.